Hi, Samantha. Hi, Sarah. Okay, now many of you will be familiar or very familiar with Philippa. Either you've met her or seen her on morning television, or from the last time we met when actually Philippa and I talked about her new book then, which was called The M Word, which was all about the menopause. But today we're here to talk about her latest book, which is out on February the 11th. This is the latest book. It's a personal diary of life and recovery from cancer. It's called Doctors Get Cancer Too and details the challenge of being both a doctor and a patient with bowel cancer all at the same time. So I thought it would be extremely helpful for Philippa to not only tell us a little bit about the book and her recent cancer diagnosis, but also to talk about the journey she's been on throughout this past year and her advice to anyone else who may sadly be going through a similar situation. So Philippa, firstly, I just want to say how sorry I am actually that I'm even here talking to you about this today. You've obviously been through a very hard year, harder than all of us put together probably, but I'm very grateful for you obviously coming on and sharing your story today. So firstly, how are you?
So,
Hi.
I'm actually doing rather well. It has been a very long. It'll be 2 years this May, and I am just literally today. I plucked up the courage to book my next set of scans and scopes, and we are crossing our fingers that they will be my first set of negatives. And waiting for your scan results is something that every patient knows will cause huge anxiety, and they say that the more negatives that you have, the easier that becomes. So I am waiting for my first, which is hopefully what we're going to get this year.
Well, please God, we're all praying that's exactly what happens. So listen, what amazes me is that we hear all the time that women should check their breasts, that women should attend cervical screening, but you never really hear advice on checking the toilet bowl after you've opened your bowels. And yet, bowel cancer is the fourth, I think, most commonest cancer in the UK. Correct me if I'm wrong.
That's
Uh,
right.
Right, and it's the second commonest cause of cancer death. So before we talk about your journey, I just want to ask you, why is there this sort of, I don't know if it's a taboo or a lack of awareness around bowel cancer?
I think there's a real reticence to talk about anything related to your genitals. Now, we talk about that all the time in women's health and being able to say the words vulva and vagina, right? But we don't talk about poo. And there is some part of us that sort of finds feces abhorrent.
Mm.
And we're taught, that farting is rude. And actually, farting is a sign of good gut health. It means that the bacteria in your gut are really healthy. But we are taught essentially that these things are shameful. Now, interestingly, that's not everywhere in the world. In Europe, they're much better at it, and actually, their toilets are designed differently. There's like a shelf. Often, if you none of us have been on holiday for a while, but think back to when you might have been on holiday, and there's sort of like a shelf often in Europe, and the reason that that shelf is there is so that you can look at your stool. And then, even if we think about, for example, breast cancer, which has a whole month dedicated to it in October, and Think Pink, and it's done such marvelous things, and it's raised so much money, and it's saved so many lives. And my cancer is jealous. Because not because I think that they should have less, I think that all the cancers need to have more and more funding. And maybe Think Brown is not as sexy,
Yeah.
but we need to be checking our poo, and then we need to be doing something about it if it isn't what we expect, and most essentially if we see blood in it.
Yeah, I mean, I think you're absolutely right. It's just not a very feminine thing, is it? And I think a lot of people have said to me anyway, when I was said you were coming on, that they always thought it was a male cancer. They just didn't think of it as a female cancer, which is,
So it does affect both men and women, and it is increasingly likely the older that you get. But it is definitely something that will affect all sexes. We all poop, right?
yeah.
And we don't talk about it. Now, I talk about it an awful lot in the book, because it's relevant, but we need to be talking about it, and we need to be teaching our children that just as they wash themselves and they brush their teeth. When you go to the toilet, stand up, check the bowl before you wipe, check what you wipe, and then throw it away.
Yeah. Well, look, so tell us, let's go back to the beginning. Tell us how old you were when you were diagnosed, first of all.
So I was 39, which is obviously extremely young. So the rates of bowel cancer will begin to rise over about 50, but they really rise significantly the older that you get. At the time when I was diagnosed at 39, my risk was 1 in 10,000. So it was rare. And none of us were looking for it, not even me. And my job is to look for it. So when you come into the doctors, right, and we don't know what you're coming in for, the moment that you open your mouth and you say something, I'm waiting to hear a word or a symptom that is going to trigger me to go down that route and to think about referring you on a 2-week wait suspected cancer pathway. So you say breast lump, you say blood in the poo, you say lots of different things, and I'm going to be thinking about that. And the signs or the symptoms of bowel cancer are commonly a change in bowel habit. So we all have a bowel habit. That means how often we go to the toilet. And it might be 6 times a day, and it might be twice a week, but it's normal for you.
Yeah.
And if that changes, so your stools get looser or more constipated for a period of at least 3 weeks, then you need to go to the doctor. Blood in the poo, and abdominal pain and unintentional weight loss. Now, I didn't have blood in the poo and I didn't have change in bowel habit. I had some intermittent abdominal pain since my youngest was born. And I've had lots of pelvic surgery, and we all thought it was due to scar tissue. And when I went to the doctor, they said, oh, we'll refer you to a gynecologist. It's probably scar tissue. And I'm so incredibly grateful to that gynecologist who went, yeah, I think it's scar tissue, but I think that because of that scar tissue, it might be stuck to the bowel. Let's just go and see a bowel surgeon to be sure. And the bowel surgeon, as they pushed the sedative when they had the colonoscopy, sort of went, we're not going to find anything. It's going to be fine. We're just going to do this operation to have the scar tissue removed later, but we're just checking. And so it took us all by surprise, but somebody has to be the 1 in 10,000.
Yes, well, I'm sorry it was you. So you were diagnosed in that way. How did, emotionally, how did you feel? Yeah, you're not just a doctor. You are actually first and foremost, a woman and a young mum with 3 lovely kids, and then a doctor. So did you see on a sort of screen? Did you know what you were looking at?
Yeah. So I think that there are times when it's wonderful to be a doctor. When they put the ultrasound scan on your belly and you see your baby's heart beating, that's wonderful for everybody. But I know exactly what I'm looking at. And when I know when my kids are sick and need help and when they just need Calpol. And there are other times where it's not so good. And I lay back and I glanced up at the screen, and it was so obvious to me that this was abnormal, and I locked eyes with the surgeon. And as he looked at me, there was this pause, and I knew, and he knew I knew, and the room got quieter and quieter, and the nurses got kinder and kinder, and they got harder and harder. And then my doctor's wall went straight up. So doctors all have this sort of wall that allows you to be the robot. It allows you to do CPR when relatives are crying. It allows you to keep functioning in difficult situations. And so straight away my head went to, what next? What are we going to do? What next? What next? And as they went through the procedure, and I'm thinking, what next? Where is it? Where is it spread to? And then I had to go and have loads of scans and lots of other investigations. And it was probably about 2 hours later that I was half naked on a changing room floor, ringing my best friend saying, I've told my husband, how do we tell the kids? And once I let that in, that's when it became really difficult. And having to go home and explain to my then 11, 7 and 4-year-old that mummy has cancer is not really something I would think that anybody would want to do. But there was no time to process, there was no time to stop, because I was heading into hospital really quickly, and I was going to be there for about 10 days. And so I couldn't not tell them. And I really firmly believe that you have to be honest with children. But all one can really say is there's a cancer in mummy's tummy, that's a bad growth, and the doctors are going to go and get it. And then the children respond how they do according to their ages. So the 4-year-old's response was, who's going to take me to school? Perfectly reasonable. And the 11-year-old wanted to talk about something that happened in one of the books that he had read where someone had died. Perfectly reasonable. But it was his 7-year-old who rushed towards me with his arms open to give me a hug and then recoiled. You can't get it. I'm not going to get it. As he sort of ran away. And so they all have different reactions. But actually dealing with everybody's reactions was something that was really hard. Because you know that everybody is going to have a reaction. And you know that they care about you, and you know that this bad thing that is happening to you is hurting them, and that can be really difficult.
Yeah, you've brought shivers down my spine. I mean, well, what about your husband?
So my husband is amazing, but I'm the doctor, and so whilst I'm okay, then he's okay. So you know, the kids are sick, as long as I'm like, yeah, it's fine, don't worry, then he's fine. The moment that I'm like, nope, something's wrong, then he begins to worry. So he really does not like it. I'm sure most partners don't like it, when their partners are sick. And before I went into hospital the first time, one of the things that I did that was heart-wrenching at the time, and I still really struggle to read them, is that I wrote letters just in case. I wrote letters to my parents, I wrote one to my husband, and I wrote one to my children. Not because I was planning to die, not because I had any intention of dying, and not because I thought I would, but just in case, because we all know that sometimes things go wrong. And what's really interesting, as I sort of wrote them, is that the one to my children is essentially, how do you put a lifetime, oh, I'm going to get upset too. How do you put a lifetime of love into a piece of paper? But the one to my husband is filled not just with love, but how can I tell you how to be both me and you? How can you be both parents? And I have huge respect for anybody out there that is doing it on their own. And so it becomes rather mundane, because actually that is how we show love. We show love by the fact that we cut up carrots for dinner when I know you don't want them, but I think you should have them. And we show love by making you go to the dentist, and by making sure that you have school shoes that fit, and all of those things. And so it became this rather mundane list of, we go to the optician here. And I remember thinking really clearly, is this going to be my parting words? Go to the dentist? But what I'm saying is, yeah. I love you, I'm still here. This is what you need to do. And thankfully, he didn't need those letters. And yet I still can't throw them away.
Look, you included one of your letters in the book, and that's when I started reading that, I broke down crying, because I actually wrote a similar letter before my hysterectomy, which I have subsequently ripped up. And that's just human nature. As a mum, you want to protect your kids and leave a roadmap, you know, if anything happened. But look, let's talk more about the sort of actually what happened. So what treatment did you have? Did you literally have to go into hospital the day after that scan?
No, so I had a few days of tests. I went into hospital the following week. So I had enough time to write a very detailed timetable, which I'm sure was completely ignored. Yeah. And then I had part of my colon removed, and was in ICU for a few days. And essentially you can't eat anything for quite a long period of time. And then you have to train your bowel to eat again. Your bowel goes to sleep once it's been touched. And I had a load of lymph nodes removed, and then I had 6 months worth of chemotherapy. And then we thought that we were done, but unfortunately they found more lesions. And in September of 2020, in the middle of the pandemic, I had a whopper and a half of a surgery, where essentially they had to cut out more of my small bowel and various other bits, and I had chemotherapy sort of directly into my tummy, and I was in hospital for 15 days. I was in ICU for 10 of them, and that was extremely difficult, but at the end of that I came out cancer free. But which is amazing, and I'm incredibly grateful. What was clear to me the whole way through, though, was cancer wants to take everything. And there is this sort of physical bit where it tries to physically take over your body and take you, but it wants to take over all the roles in your life. And mine, like all of yours, were multiple, you know, wife, mother, sister, daughter, friend, and all the work things that I do, you know, doctor, journalist, media, and school governor. And I didn't want it to take them all away, because those roles they make up who I am. They make up sort of Philippa, they make up the person. And I didn't want to just be Philippa the cancer patient. And I think that's true of lots of people with cancer, is that every conversation and every relationship and every encounter become about the cancer. You know, be that hospital appointments, or be that seeing your friends. Where are you? What are you doing? Can I help? Can I not help? You know, what's going to happen next? And actually, before cancer, maybe you were funny, maybe you were clever, maybe you were interesting, maybe you like gossip, I don't know. But those things still exist. And so if you have a friend out there and they like talking about shoes, sometimes they probably still want to talk about shoes, because the person that they still were, it still exists. And for me, a big part of that was going back to work and working as much as I could.
Did you have that energy to actually go back to work? I mean, how was your recovery from, you know, the second time you were in hospital?
So my medical team clocked me very early on as somebody that needed to be told when to stop. So they said, you can't work for this amount of time. And for the first one, had they not told me that, I would have pushed quite hard against it. For the second time, I was so sick, I knew it was going to take me a couple of months to be able to practice safely. And that's really important, is that you've got to be safe. So once I recovered from the surgery, I was able to go back. And then with chemotherapy, it's very difficult to predict what's going to happen. And that's the difficulty, is I like answers. Doctors really like to have plan A, plan B, plan C. And yet you don't know how tired you're going to be. You don't know how sick you're going to be. And so it's really difficult to plan. And then you have to balance, what is tiredness that I can push through? What is tiredness that I can and should exercise through to give me more energy? And when should I listen to my body and stop? And sometimes I got that wrong, and sometimes I got that right. And sometimes I was tired but needed to do it anyway, so that I remembered who I was. And so that's a balance that had to be struck over and over. My mother will probably tell you that I got it wrong and did too much. And I would say that often it was essential for me to keep functioning.
Yeah, I mean, us women, they always say, you want something done, give it to a busy woman. I thought I was busy, but you're definitely probably one of the busiest women I've ever known. So, you know, but yeah, in your book, you talk about self-care, and I totally agree with you, and it made me laugh. I'm not a fan of all the sort of Instagram posts where it's all about sort of fluffy self-care. I think self-care, as you wrote in your book, is about having a roof over your head, food on your table, love, and then anything else that you can do for yourself, whether it's a bath or a walk or read a book, you know, it is absolutely essential, so that you don't, you know, suffer burnout, because we can't look after all ourselves, let alone others around us, unless, you know.
And I think that, I mean, I know I really battled with the idea that recuperation time and convalescence was selfish.
Yeah.
And I felt really guilty about it. And actually, as a sort of society, we used to be really good at it. When we didn't have medicine that could solve everything, we were really good at it. And you were sent off to the coast, right?
Yeah.
And you went for lovely walks by the sea, and you ate good food, and your body healed, because your body is amazingly resilient and astounding. But our culture now says, A, medicine should fix it, and B, you're back, and therefore you're back firing on all cylinders. And so it often felt very selfish to say no and to stop. And that was something that I really battled with. But unless you have a self, you can't do anything.
Absolutely. So I do want to talk to you briefly about the screening program, but just tell us, what's your prognosis like, in terms of where you are now, and please God, everything will be negative.
So my prognosis now is a 5-year survival of about 90 to 95%. So my prognosis is excellent. My recurrence risk, so prognosis is whether or not you're still here, whether or not you've survived, but your recurrence rate is whether or not the cancer has come back, and that's probably high. That's about 20 to 30%. And I will be having regular follow-ups and scans and scopes for the rest of my life, actually, because they found a gene that doubles my risk of bowel cancer. So it might have been 1 in 10,000 for the average population, but it became 2 in 10,000, which is still incredibly rare. But essentially, I'm at higher risk of developing a new one, never mind my old one coming back. So I will still be having that. But for everybody else, the screening program starts at 60. Now, the government agreed to bring down that screening age to 50 because that's when the numbers start to rise, but there's been no start date for that put into place. Now, what happens is that you get sent a little kit home and you have to give a sample of poo, and they look for hidden blood that you can't see within that. And if they find that, then you'll be invited for a colonoscopy. Now, some of you out there might have had what's called a one-off scope screening. And that used to be in some parts of the country, not everywhere, from the age of 55, that you would have a one-off scope to have a look inside the bowel. But that screening program has stopped. So if you were somebody that was sent a letter before the pandemic, and then they've said, oh, we've cancelled it because of the pandemic, from April this year, you will be getting one of these screening tests that involves looking for poo. They're not offering currently one-off screening scopes. But so for everybody else, it's over the age of 60. And I really desperately hope that it does come down like the government promised to 50. But no matter how old you are, no matter whether or not you think you've got hemorrhoids or something else, if you have blood in the poo, if you have a change in bowel habits, so knowing what is normal for you and something else has happened, or persistent tummy pain, you really need to go and talk to your GP.
Right, that's really, really good advice, Philippa. So it's obviously that it's important for people to get an early diagnosis, and for anyone who's sadly recently been diagnosed, what would your advice be to them? Or if you could give them one piece of advice from what you've been through.
So the first thing is that for everybody who's got symptoms, time matters. The earlier that you are picked up, the easier it will be to treat and the better that your prognosis will be. And had I not been picked up luckily when I was, in all likelihood, I would have presented as a medical emergency with something called obstruction, intestinal obstruction. I was very close to that point. 1 in 2 of us will have cancer at some point in our lives. And that means that all of us, every single one of us, is going to know somebody at some point with cancer. And so actually my piece of advice to both the person affected and your family is this: whatever feelings you have, they're okay. And they're all big and they're all conflicting, and you can be angry and sad, and you can be brave and trudge on anyway, because that's where the true strength is, in that sort of keeping on bit. And so you can have all these conflicting emotions. You can know that you're going, but desperately not want to go to your chemotherapy. And all of that is okay. And for your friends and family to be able to hear that and to be able to listen and to not always try to fix it, because that's what they do. When we love somebody, we want to fix it. But actually what they need, or most especially what I needed, was to not feel on my own. And for just for a minute, if you could sit with me when I feel sad without trying to fix it, then that would give me the strength to carry on. And so I would just say, please listen, and just whatever they feel, they feel.
Well, I'm going to read you 3 messages, just because otherwise I'm going to start crying again. Helena Greenfield says, Philippa, you're an amazing lady. She is. Danielle Levy says, you're an amazing inspiration and you look beautiful. You do.
Thank you.
I've always said Philippa's like a brunette Marilyn Monroe. And Sharon Rosen says, wonderful talk. I did miss the beginning. What were your initial symptoms, please?
So unfortunately, they weren't the sort of barn door symptoms we were saying. I didn't have blood and I didn't have change in bowel habit. I just had really sort of intermittent pain. But in the book, actually, people were mentioning what you look like. And in the book we cover body image, because when your body comes to get you, it's hard to love it. And when your hair's falling out, and when your skin goes grey because of chemotherapy, you know, and actually I cover all of that there. And it just, if it helps anybody understand what it is like to go through, and if it helps anybody help someone else, then I'm really grateful to be that person for you.
Well, thank you so much, Philippa, for coming in today. And I'll just say that if you've noticed any symptoms described here today, please see your GP. And if you'd like to read more of Philippa's book as a young doctor and mum of 3, her diary of that time, Doctors Get Cancer Too, it's published by, is it V or Vi?
V.
VIE. It's available, I think it's February the 11th, am I right?
That's right, but you can, I mean, none of us are going to bookshops at the moment,
Right.
so you can get it online, and I really hope that you enjoy it. This is a big departure from a menopause book and a pregnancy book. It's very personal, so I'm a bit nervous.
It's a really, you know, really interesting read, and it gets to my heart a lot. But you can find the link in the blog post that Philippa has written for us. It's on our website, and obviously we're going to share this interview on all our channels and websites so people can rewatch it later. So just you take care, Philippa, and just carry on being well, and I'm sure we're going to get some good news very soon. So God bless and thank you.
Thank you for having me.
Take care.